Hi, I'm David Green, CEO of the Florida Pain Network, where we connect those in pain with the best pain relievers throughout the state. That includes pain clinics, pain management doctors, chiropractors, and physical therapy practices. Today, the topic I want to discuss is spinal cord stimulators, the how and the why of a patient moving through the process of getting one. Well, what is it? It is one of the best pain management procedures today. And it's great as a last resort. It's not something where you have back pain for a few months and then you just get one. That's not really what it's for. Essentially, patients who are eligible for a spinal cord stimulator are those who have no more options. They have either had surgery and didn't get enough pain relief or it just didn't work, or they had a surgery with a really good outcome initially and then maybe develop some scar tissue around some nerve roots, in the ensuing 6 to 12 months. That is very unfortunate because you had the great result, but your body just decided to make scar tissue around those nerve roots. You can get further surgery to remove that scar tissue, but what's going to happen? It's going to come right back. So that's a problem. So at a certain point, a better option is not to try and do that, but to go with something like a spinal cord stimulator that can mask the pain. It doesn't fix anything, it just masks it, okay? So how does it work? Well, I brought a visual aid here, a little whiteboard. It's about the size of a hockey puck is the battery, okay? And then off of it comes an electrode, and it's real thin like this. And what it goes to is a little lead at the end. So when a patient is first considering a spinal cord stimulator, you have what's known as a trial. So the doctor basically gets approval and takes you to a surgery center or a hospital, and you have to stay awake during the trial because they need input from you. So it's a really, really small incision. This part gets fed through the soft tissues and into the area around the spinal cord, and this gets positioned to usually midline, and the doctor says okay, they turn it on, this comes out of the skin, so the skin's here, and this gets programmed outside the skin, and the doctor will say, okay, does that help with the area where your pain is? Do you feel a tingling over that area, whether it's your right leg, left leg, what have you? If you say yes, then that's good. If not, they just move it one way or another, okay? So once that's in place properly, it's sutured to the skin, sterile dressing is applied, and then this you end up wearing on your waist for 5 to 7 days. And you go in the office and you have a journal that you've kept of how much pain relief that you received, and you give that to the doctor. And if you have an average of over 50% pain relief from this trial, then there is an indication to go to the final, which basically looks like this, but it's all underneath the skin. And the paddle lead is not that thin. It's actually about, looks like that. And there's little diodes on it, okay? So in the final surgery, what the doctor will do is make a bigger incision, take out a little bit of bone around the spinal canal, and feed this paddle, which is decent size actually, with the lead coming off of it, over the area of the spinal cord. And that can be programmed a ton of different ways and give you decent back pain relief as well as leg pain relief. And they're doing different leads now to where sometimes they can put one underneath the skin as well as around the spinal canal. So they're tweaking it to get even better results. Usually you will need a psychological evaluation to get final approval from the insurance company. These are very expensive devices. I think they're around $15,000 for the final implant with the battery and all the stuff, okay? But they keep getting better and better. No longer do you have to use it for a few years and the battery dies. It's actually rechargeable now. You wear something around your waist every few nights and it just charges while you sleep. And there's all kinds of programs now too. It used to be there were only a few. Now with all the diodes on it, there's umpteen. So a recent study came out looking at the results of spinal cord stimulators. And they showed that if a spinal cord stimulator is utilized when a patient first develops chronic pain, but not over 2 years, 85% effective. really good results. Okay, now if it's between 2 and 5 years of chronic pain, it drops down to about 68%. And then if it's over 5 years of chronic pain, it still can be effective, but it's only around 50%. And those results mean that it gets rid of at least 50% of a patient's pain. It can decrease the amount of narcotics, it can decrease the disability, time from work. Patients can play with their kids, they can have a better social existence. It really can be a godsend to a patient who has minimal other options, except to go on, chronic narcotics and deal with those kind of side effects. So anyway, a lot of more information on the site at floridapainnetwork.com. And if you're looking for a pain doctor or a chiropractor or a physical therapy clinic, go on the site, type in your zip code, it's geo-targeted, and it will show you the clinics or chiropractors that are closest to you for treatment. Thanks, I'm David Green, Florida Pain Network. Your pain stops here.